I have lines and bags under my eyes. Would you recommend surgery or a filler? I have lines and bags under my eyes, and I'm not sure how to handle them. I've tried peels, creams, serums. I'm not just getting great results under the eye anymore.
Thank you for your question. You stated in your question that you have lines and bags under the eyes and that at this point creams and peels are simply not working. So you're asking a very reasonable question as what to do. Well, looking at the photos you submitted, it is clear that there are a lot of fine lines under the eyes and that it appears that you have fairly light skin. I'll give you an idea of how we approach evaluating eyes in our practice. I'm an oculofacial cosmetic surgeon, so I do a lot of eyelid procedures. And for lower eyelid rejuvenation, there are some key elements that should be addressed, in my opinion, that maximize the results. So first we look for something called lower eyelid fat prolapse. That means that the eyes are puffy all the time and regardless of sleep or management of allergies or sinuses. That puffiness is fat. It's fat that is herniated and pushed forward. Now, in order to address this fat, we do something called a lower eyelid blepharoplasty. Depending on the presence of redundant skin or laxity of the lateral canthal tendon or the tendon that supports the lower eyelid, we make decisions on whether to do an external approach called a transcutaneous blepharoplasty or an internal approach called a transconjunctival blepharoplasty. Most of my patients who come for eyelid surgery typically don't have excess skin, and so I generally do a transconjunctival blepharoplasty. If they do have some extra skin, we do something called a transconjunctival blepharoplasty with like a skin pinch excision. But that's more details about the surgical procedure. But in order to address puffiness, a surgical procedure called a blepharoplasty is what is generally performed. In our practice, we do this under local anesthesia with light IV sedation. Now, years ago, when I would do an isolated blepharoplasty, I was always challenged with the issue of how to manage the skin. Because when you look at the aesthetics of the eye, the puffiness is a big negative, and at the same time, fine lines and wrinkles also makes the eyes look aged in appearance. Now, a very important distinction to make is to distinguish skin quantity from skin quality. Very often, people who have wrinkles under the eyes believe and will undergo procedures to remove what appears to be excess skin. Unfortunately, a lot of those people who feel that they have extra skin and the surgeon believes they can address the extra skin unfortunately will have a shortage of skin after the surgery. And that explains why a lot of people have a rounded lower eyelid. In other words, their eyelids get pulled down to the point where they see a lot more of the white of the eye, and that's referred to as lower eyelid retraction. So I would advise you to be cautious about that approach with an understanding that skin quality versus quantity has to be made a distinction. When you have fine lines under the eyes, then skin quality is really, in my experience, the dominant issue. So when we look at skin quality, what are we dealing with? We're dealing with loss of collagen. We're looking at loss of blood supply and just the thickness of the skin. Now, eyelid skin is only 0.5 millimeter in thickness, so the skin getting thinner is an issue. Our current approach to addressing skin quality is usually a combination of application under the skin of something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood and it concentrates the growth factors necessary to actually heal. And so we stimulate collagen, blood supply, and improve skin quality. And in addition, we'll use something like the fractional CO2 laser. The fractional CO2 laser also addresses the superficial lines as well as improves the skin quality through collagen stimulation. So I suggest that you meet with qualified, experienced cosmetic surgeons, particularly those who have a lot of experience with eyelid surgery, and understand that there are some potential pitfalls. Last but not least is, of course, the integrity of the support structures of the lower eyelid, which also need to be addressed and is often overlooked by a lot of general plastic surgeons. So that being said, meet with qualified, experienced cosmetic surgeons and get a sense of what your options are, and hopefully this information will help guide you. So I wish you the best of luck. I hope that was helpful. Thank you for your question.